One of our long-term goals here at Womb Warrior is fostering a real sense of self and connection for women in the birth community. We're trying to create a digital platform where people like you have the ability and option to ask questions to some of our favorite birth professionals. Watch us today as we debut our Ask the Midwife segment with Abby Rhoda, a private midwife who runs out of the Nest on Silas. You can submit any of your questions to facebook.com/wombwarrior or directly to me at angela@wombwarrior.com.au. See you soon.
Samantha from Calgary, Alberta asks, my first labour was 4 hours. The OB said my second birth is bound to be quick, but the drive to hospital is an hour away. How can I be prepared if I have Bubba in the car before we get there? What do I do? Well, Samantha, thanks for your question. 4 hours is pretty fast for a first birth, and it's very likely that your OB is right, that you will have a quick second birth. Saying that, it does depend very much on if your waters broke before you went into labour with your first baby. And if your waters broke before you went into labour with your first baby, and then you progressed into labour quite quickly with your first baby, if your waters don't break the second time before you go into labour, it may be a more gentle warm-up, so you might find that you have more time. If your waters didn't break and you went into labour spontaneously and it was 4 hours from woe to go, then I would definitely say pack the car for a baby on the way. And when you get that first contraction that holds you up, you definitely want to be thinking about getting in the car. What you want to take in the car with you are some towels, some baby blankets. Make sure you take your phone, that you've got a phone charger, that you've got ambulance cover if you don't already have it, that you take a change of clothes for you, and a blanket. It depends what time of year it is in Alberta as well. I would also talk to your husband or your partner, whoever's in the car with you, about what to do when Bub's being born. So you actually don't need to do anything, you just allow your baby to come. When Bub's born, you just bring baby up and put Bub on your chest, skin to skin, and blankets over you, if it happens to be in the car. And I would say pull over, don't keep driving. If you start to feel the urge to push, do it safely with your partner calm beside you, or as calm as they can be. You don't need to cut the cord, you don't need scissors, you don't need clamps. Consider calling an ambulance so they can get there to be with you, because I imagine that your husband or your partner will be full of nerves, and driving is probably not the safest thing. And also depends on the weather also. And I would just sit there. Bubs sometimes can take a little while to look like they want to breathe, and they can sit there with their lips pursed and their eyes staring at you, a bit like, and they're moving. And a minute can feel like a long time, but it's not abnormal for a baby to take up to 1 minute to take that first breath. So what you can do is just rub them up, talk to them, hold them close, keep them skin to skin with you. And if babies are coming that quickly, it's usually everything is just fine. So I hope that helps, and I look forward to hearing your story when the time comes. Rachel from Coburn asks, I keep hearing that if your waters break, you have to go to the hospital as soon as possible. Is there any truth in this? Well, Rachel, thanks for your question. It very much depends on your hospital policy and on where you're choosing to birth. If you are birthing in a private hospital, you may find that the private obstetrician has their own point of view about what they would like you to do. And I can't respond from their point of view. I can respond from the perspective of a major tertiary hospital guidelines, and if you, at 36 weeks, you have swabs done or offered swabs to be done for group B strep bacteria. So, and 1 in 4 women carry group B strep. If you choose to have these swabs done and it comes back that you're positive for group B strep, you'll be offered antibiotics in labour. If your waters break and you're group B strep positive, this increases your chances of infection for your baby. So what some places want you to do is to come into hospital and be induced within 4 hours. Some women who choose not to have the swabs, so their group B strep unknown, or they've been swabbed and they're negative, if their waters break, they have up to 24 hours in some hospitals and 18 hours in others before they are asked to come in and be induced and put on antibiotics. The other thing to consider is if your waters break, are they clear or is there colour there? If it's green or brown or flecky with meconium, this can mean that bub's distressed. It can also mean that bub's just a little bit overcooked and ready to be born. However, it's something always worthwhile getting checked out. If there is meconium in there, they'll want to induce you straight away, and they'll want to put a continuous monitor on your baby just to make sure bub copes well with labour. And so Rachel, in response to your question, there is no one answer, and I would suggest that you contact your care provider if you find yourself in this situation. Thanks for your question. Lizzie from Sydney asks, we just had our 8-week scan and there seemed to be an empty sac. I'm really worried. What could this mean? We've been trying to conceive for a year and the wait is agonising. Lizzie, I imagine the wait is agonising, and you'll find that you're not alone in this situation. Many women these days are struggling to conceive. What I would suggest to do is to find a way to calm your mind and accept the fact that right now you don't have any control. The empty sac doesn't necessarily mean that your baby isn't okay, and unless you have bleeding or pain, there is hope yet for your little one. I would suggest doing things like yoga, going to the beach, do all the things that you love. For me, it would be going to the beach, spending time with friends that I love and feel like I can be wobbly with, and still can make me laugh while I'm waiting to find out. You'll have a 12-week scan, and this will be more confirming as to whether your baby's okay or not. And I really hope that your baby is okay. Thanks for your question. Rose from Fremantle asks, I'm planning a home birth. Tell me some of the reasons I might transfer to hospital. Now Rose, I'm assuming you're meaning in labour, and if I have this wrong, please feel free to ask again. The main reason that transfer happens is for first-time mums, and labour itself is broken up into 3 phases, as you're probably aware. So we've got latent phase of labour, first phase of labour, second phase of labour, it's actually 4 phases, and third phase, but latent isn't given a number. For first-time mums, our cervix is long and hard like our nose, and it's got to thin out to become soft and stretchy like our lips until it becomes paper thin and 4 centimetres dilated. When that happens, we're then considered in established labour, so 4 centimetres dilated and paper thin cervix, and contracting every 3 to 4 minutes, lasting a good long minute. The main reason that a first-time mum will transfer is if baby's back is against your back and it's got its head up and deflexed rather than tucked down and flexed like this. So there's an uneven area putting pressure on your cervix, which causes sporadic or infrequent contractions that are varying in intensity and varying in strength, regularity, sorry. And what this does is it causes the cervix to take a long time to thin out, or efface, and to dilate. And what we can do as first-time mums is become really exhausted. It can go on for quite a few days. We get quite a lot of back pain with this type of labour, because of the intensity of it, we don't eat, we don't drink, we don't sleep, and we become exhausted. And so what often happens, and I think it's roughly about 15% of first-time mums will transfer for this reason usually. And what happens, they go into hospital and they'll have often an epidural or a shot of morphine. They'll be able to eat and drink, they'll be able to sleep, and either the drip will go up if their waters have already broken, or their waters will be broken when they're in hospital, and their labour will progress. And usually, most of the time, they have a vaginal birth at the end, which is pretty amazing. So that's the main reason that we would transfer in. Bub's normally fine, and this is assessed with your midwife at home, and the decision is made collaboratively before you go in. The other reason is in the instance of emergencies. So if Bub's distressed during labour, and we monitor this by listening to your baby every half an hour during labour, and when you're pushing, roughly every 5 minutes, and we just check in with baby's heartbeat to make sure that it's reacting as we want it to that shows that Bub's healthy through labour. Ordinarily, because labour is not induced and we're not imposing any medical intervention, most babies cope beautifully with labour. So that's an uncommon reason to transfer, however, it is a reason. And other reasons are like true obstetric emergencies. So if a mama has a postpartum hemorrhage, which can be as a result of a long labour, or if she's her placenta's not wanting to come away and is kind of partially removed itself, or if she has a vaginal tear, a perineal tear that bleeds. Another reason is if baby's not breathing so well after birth and we have concerns about Bub's well-being, then we definitely hightail it to hospital to make sure your baby's okay. They're like for multips or women having second, third, fourth babies, they would be the reasons most likely that we would transfer. Saying that, it's very unusual for that to happen because we are having a natural uninterrupted labour where oxytocin levels are beautiful, women are given the space to labour as they need to, babies are not being treated with syntocinon or the synthetic hormone that causes contractions to happen, and being squeezed like 4 to 5 contractions in 10 minutes. Natural labour seems to be more like 3 to 4 contractions in 10 minutes, which gives Bub lots of time to recover. And women are coping emotionally and psychologically in a beautiful way. So there are some of the reasons why we may transfer. And thank you very much for your question. I hope this helps.